Canada has a big problem with addiction and mental health. About 1 in 5 families is affected by this.
We estimate that about 8 to 9% of all Canadians will develop post-traumatic stress disorder over the course of their lifetimes.
We know that about 1 in 10 people suffer from addictions or substance abuse. The truth is we know surprisingly little about how to treat addiction and mental health.
HRI has the ability to bring people together across the country, researchers, clinicians, patients, to do together what none of us could do alone.
At HRI, we are undertaking a multi-year research study called the Recovery Journey Project. The objective of this project is really to understand what the process of recovery looks like post-treatment.
We're very interested in creating a living laboratory. What we're hoping to do is to test and trial novel treatment interventions in the clinical setting.
When the Schlegels bought Homewood Health, they had a vision. What they wanted to do was open Homewood Health as a set of living research laboratories across the country, and they wanted HRI to work in that research environment to do research that would improve lives and improve outcomes of mental health and addiction treatment. The way to shorten the gap between research and practice is to have clinicians collaborating with scientists, and that's one of our unique features.
By testing our work in a clinical setting and receiving continuous feedback from patients, from clinicians, from hospital administrators, and from policymakers, we're able to adapt treatments as quickly as possible to bring them to patients as quickly as possible.
By setting up this data system, we really can take advantage of natural experiments that might be happening within these different treatment contexts, and to try to understand what it is about those treatments and about those contexts and about those individuals who are receiving treatment that really might make the difference.
If we're going to focus our resources on the things that make the difference, the approaches that make the difference, we need to know a lot more about long-term outcomes than we currently do.
The work that we do helps to make the invisible visible.
It will also help us understand the recovery process.
This is not something we can do alone, but we want to be part of bringing people together so that as the cancer world is organized, we can help do our bit to organize the mental health world across the country.